Hey everyone, my name is Mally Green. This is my final project for Dr. Brown's AI class. One of the topics we discussed in class, and the one that I'm going to talk about today, is reproductive diseases. I feel like whether you artificially inseminate your cows or you use natural service, reproductive diseases are something that I believe everybody should have at least a basic knowledge of, because it can happen in any type of cows, whether you have a large cattle operation at home or if you're just a small-time hobby farmer, it could still happen. The first one I'm going to talk about, probably one of the most well-known reproductive diseases, is brucellosis, also known as Bang's disease. It's caused by the Brucella bacteria. It can affect humans and can be rapidly spread between humans and other cattle by direct contact. Symptoms include decreased milk production, weight loss, lameness, infertility, and the most well-known symptom is abortion or the birth of weak calves. And young cattle that are affected are also more likely to die than mature cattle. Currently, there is no cure for brucellosis. Most commonly, the symptoms disappear and the animal remains diseased. To prevent the spread, infected animals are sent to slaughter. But most commonly, they're vaccinated prior to. The vaccine is a live vaccine that must be administered by an accredited veterinarian or state or federal animal health official. Due to vaccine protocols, brucellosis cases are very rare. When you go to get your heifer vaccinated, usually they recommend between 4 to 12 months getting vaccinated for Bang's disease. They will put a tattoo in the heifer's ear and a little clip on their ear that has an ID number in their right ear. The vaccine they currently use is RB51, and like I said, they vaccinate between 4 to 12 months of age. That's the recommended time frame. The next one I'm going to talk about is leptospirosis, or lepto as we most commonly know it. It can cause low-grade uterine infections, abortions, or mastitis. It can build up unrecognized in a herd very easily before it's detected. Droplets of urine from infected cows can infect healthy cows after contact with the eyes, nose, or mouth. You can prevent lepto by draining stagnant water, control rodents or pests wherever you store your feed, or if you keep your cows in a barn, just try to control the rodents and pests because they could spread lepto very easily, or other sicknesses. And vaccinate, which is what mostly everybody does. That's why it's important to have a vaccine protocol in place to prevent all these diseases from ever occurring in your herd. The primary sign of infection is in the kidneys, and lepto is also transmissible to humans. Abortion several weeks after the infection passes through the herd may be the only evidence that infection was there. Identifying the organisms from the stomach contents of the aborted fetus will confirm the diagnosis that that cow was infected with lepto. If infected animals that are infected early on and you catch it early enough, should respond well to antibiotics, but like I said, we try to promote vaccinating all of your cattle for these diseases prior to. Another one is vibriosis, or Vibrio as we call it. The only evidence of infection is infertility and irregular heat periods, and it can also cause early embryonic death if the cow is infected early in the pregnancy. When the disease first appears in a herd, it's usually due to a new addition, either a new bull or a new source of bull semen that was untreated. There are no clinical signs of Vibrio, so months may go by before you realize that your cows are not conceiving or breeding back like they should be. After initial vaccination, a booster is recommended annually, preferably a month before your breeding season occurs. So about a month before you decide to AI your cows, or a month before you decide to turn your bull out on them, I would go ahead and give them a booster shot for Vibrio. The next one is BVD, or bovine viral diarrhea. It's the most prevalent viral infection in cattle. It's more frequent in yearlings, weaned calves. Positive antibodies indicate that upward of 75% of cattle have encountered the virus and have become immune. Only a small percentage of cattle ever show clinical signs of the disease. It can be transmitted through carrier animals or contaminated clothing and vehicles. So if you have been around an animal that has contracted BVD, you could very easily spread it to your own cattle or somebody else's cattle. The earliest clinical sign of BVD is high fever and loss of appetite. That usually occurs 4 to 7 days after infection. Other symptoms include watery diarrhea, violent straining, or rapid weight loss. Sometimes another symptom is their muzzle can be crusty and the nostrils are plugged with sticky mucus. And BVD can also cause abortion at any stage in gestation if it's in mature cattle. Another one is IBR, infectious bovine rhinotracheitis. It's a common upper respiratory infection. It affects cattle of all ages. The symptoms include dry cough, fever, lack of appetite, clear nasal discharge. IBR is rarely fatal for cattle, but it also can cause abortions and pink eye-like symptoms. There's no effective treatment for IBR currently, but antibiotics will help to control it. So that can also cause abortions in your cattle, which if you're a rancher, you know that anytime you lose a calf, I mean, it's very hard just to lose that money, but also to lose a calf and have an animal infected with any of these diseases. One of the ones that affects bulls that we rarely really see cases of it is trichomoniasis, or trick as we call it. The disease is spread to the cow from the bull, and if the cow is given complete sexual rest, the disease will generally disappear after several months if the cow does contract trick. Results in early embryonic death, irregular heat periods, abortion, or pyometria, which is uterine infections. If you do not trick test your bulls, the whole herd may be infected before the disease is noticed. And if a bull is diagnosed with trick, it typically isn't worth the time or money to get him healthy again. Usually for regular ranchers, it's easier to find a replacement bull for your herd if you use natural service. For prevention of trick, you can use tested semen that is trick negative through artificial insemination, or you can use a virgin bull. And get bulls trick tested before turning them out with your herd. So if you were to buy a bull through an independent breeder, usually they guarantee fertility and trick test, and they try to handle all that for you prior to. Just depends on the age of the bull, at what age they decide to sell him. But if you were to purchase a bull through your local sale barn, they do require papers that say he's either trick-free from a vet, or they trick test on site and wait for the results to come back before they let you take the bull home, just to make sure that he's not spreading that disease to all of your cows. Because if you have that certain bull on, say, 30 cows at home, that's 30 cows that can potentially be infected by that bull, and that can be detrimental to a small-time farmer that doesn't have a lot of money backing in it, or is kind of depending on having calves every year to pay certain bills, or he just enjoys it. It's detrimental to lose a calf or a cow at any point. So it's important to always vaccinate your cows and deworm everything as well. But reproductive diseases can happen at any point, even if you vaccinate them. But vaccinating your cows and your bulls, and getting your bulls tested every year, and getting a breeding soundness exam done, really lowers your chances of any of your herd being infected by these reproductive diseases. Thank you.